na omo wo junso mu yare no ye binum so wo ho na okwa ohu se gise ebi a ochim ansa na junso kakra no aba iti no nina no ose moa ben na ye betumi ede ama no moa edi kan me de be ma o kese ne se bomode ane koko hu doctor ko ayarisabia ebi za junso mu yare ye mfa ni agro wan wi ye na jafra kosoro akofa we say sabo no anase kidney no wan wi ye na kokofa eja kidney no problems be breed ya bro iti misraw se wo ho na se ojunso no etisa bomodia se obaka ko hu doctor obabi awo doctor ne be wi ojunso mu obayi ye test ahodo be breed no no wa hwede ekoso no obema wodro ene no nyame adom made achi ade san ya ade achi ene no no be breed aba doctor for timi de bwanko for ema omunya omofa ahudi iti no I'm pleading with the lady. She says that she has she urinates frequently. If she doesn't hurry up to the washroom, sometimes she even wets her panties. So the question that I would want to pose is that does she urinate with pain? Does the urine come with pain? Does she feel the pain during the urination, after the urination, or before urination, or throughout? There are some of the people who have scanty urine. When they go to the washroom, the urine comes out in bits. They urinate, they have small volume of urine and it goes off just within a short time. They feel like urinating again. And there are some of the people who have to strain themselves before they can urinate. But some people who also have diabetes. Diabetes can also pose like that. You may urinate frequently. We have what we called polyuria, polydipsia, and polyphagia. Those with diabetes may have frequent urination. There's some may drink water at frequent intervals, and there's some of them who may also eat at quicker or shorter intervals. So said you can say oka say ya eja Peter ho ne edeko opeso pama career edeko te la ho yo baby are ne edeko no said the tea biano say ye diabetes so eye junso mu yare o say eye normal o hu be hia say doctor be hwehwe mu ye doctor be fiu hwehwe mu ye no aka say ja me hwe ha no hwi ni mu ambi aja be nsu a onom ne bebre ntino na bi ama junso no ekosa basa wan kan ho na junso go ho dia be giri say betuma e junso mu yare. So I will advise that you go and see your doctor right now.
CPF Women's Lab yebusu ekakai mu ese obaby a white anase odepo eha no bra niemwa obema wonso jonso ya ewo so anase oni obehia wo mu ha bebre no awo na ya opena anase wo nufo mu ha bebre eno nso uba CPF Women's Lab ha ye wo emwa edema se what hepatitis B yare nka yare amwa na etima brebo mu kokram na efensu no ese brebo no kra no CPF Women's Lab hanyenye umoja mu hwehwe mu hwe se wo bi anase woni bi se wo ye negative anase wo ye positive ni ama akwankyere. CPF Women's Lab ye woni o Achimota Kingsby.
Welcome back. You are still on the Complete Woman television show. I just answered a question from a lady who said she's been experiencing frequent micturition or urination. Said it's na sesia na me boa Arabia or say or Johnson 10 question be aja or debre na obi so no edit text message said them di kan multimedia e be the text message ba e be the eja send email or internet so e be free the mo friend the eja ye beka e be atremo and e be so no tro e be kra tare nsensem bebre no e de ba obi asema watcho or say well, I'm called so and so. We don't need her name. I'm called. I have a problem. I'm discharging and it smells like egg. She said my vagina is not itching, but I have some small swelling around it. Please, what should I do? Well, the question be about Sebio or now say or how be or say in so ifi na nemu eba. Na ne pampan ti se kusua apro. You said it smells like rotten egg. Now I say sebi na say enkeka and so no owo bibi ahono bibi kakra bi ahono wo na namu na ano ho baby bibi kakra ahono na obe den na asemu a ewo ho ne say sebi o ya chechire hu bibiri say oye oba na wo ho na insu bi fi wanamu ba na ewo nka bi a enye enka papa ya chocho enwo nsem bibiri ya kan ho nsem bibiri wo afidi so say and who be here say obi di kan or say what should I do? And who be here say obako hu doctor? If you are experiencing any strange vaginal odor or discharge, the first and the most important thing is to see your doctor, because we have normal vaginal discharge. I've been talking a lot about this, that the vaginal discharges, the mouth, the nose, the eye, the body. There are a lot of places in the body that we have normal discharge, and the vagina also has a normal discharge. But if the discharge coming out of the vagina has an offensive smell or a strange odor, then it's very important that you approach your doctor. And this is very important. It's a very sensitive topic. There are a lot of women who have lost their relationship. They have lost their marriage. A lot of women have really, there are quite a lot of women who have lost their marriage. There are some, their husbands and partners even don't want to even get close to them because of the odor which they experience, together with the discharge. But I believe that, this thing can be treated. It should not be a cause, or it should not be the reason why a relationship should break up. It should not be the cause of a divorce, because there is help. If you are experiencing an offensive vaginal odor, it could be due to, vaginal infection. It could be due to, poor vaginal hygiene. It could be due to, sexually transmitted infection. There are so many possible causes of offensive vaginal discharge. But the key thing which I want to register in the minds of our viewers is that the possibility of having an infection is very high. And I even said in one of the discussions which we had on this program that it could even be some of the cancers of the female genital tract. So an odor coming out of the vagina or a discharge which has an offensive odor should not be treated lightly. It should not be solved with it should not be solved in your own way. It should not be solved with just washing and applying vaginal deodorant and strong scented perfume. It should not be managed with, you should not treat it in your own way. It needs to be treated properly by a doctor after you have been examined and sample been taken. And as I'm discussing this, it's very important that every woman get herself examined at once every year. It's important you have vaginal assessment. A sample of the vaginal discharge would have to be taken to the laboratory for it to be analyzed and to find out the kind of bacteria or the organism causing that offensive discharge. And then and then adeba kokra paya na eye manije ana mani kan say and then no kan so bakra po bu ni nsa ana se obakwa fichiri na owajumam na one ne nam fo krampo wo ho ana se on owajumam na se opese osere kwan se ebia se bi wabu ni nsa ntinu no ye na ya se we no te na bia o ntimi krampo no enye adwuma kani no naja school for microphone to me in Kanwasem. But no, women are boldly, they boldly say, oh, I'm in my menses. It looks like I have menstrual pain. I have this and that. So, talking about the discharge, there is no issue about being shy or being afraid. And please, men who are, in marriage, I want to encourage all of you and people in sexual relationship. I want to encourage all of you that if your wife or your partner has a problem that needs to be treated, be bold and take her to the clinic or the hospital for the doctor to examine her, because even the man may even have to be treated once you are sexually involved. If you just push her away, that we're talking about gonorrhea, we're talking about chlamydia, we're talking about candidiasis, we're talking about trichomonas vaginalis. There are so many conditions and so many problems which could, cause this order. The long-awaited Complete Woman newspaper, the 3rd edition, is in, and I'm sure you saw some of you have seen it on the street. This is the paper. Let's get it for the people to watch it. Yes. And the topic is mouth gonorrhea. People say that, they say in jokes and they say around that people don't like reading, but we want to inculcate the habit of reading, especially health materials, in the people, the students, and our people in general. I want every home to get a copy. It's available on the street. We're treating very interesting topic. Now, people have been talking about gonorrhea. Gonorrhea is on the lip of almost everyone. Most people know about it. But I wonder whether people know that people can contract gonorrhea in their throats. But we have tried to simplify it by putting it mouth gonorrhea, a silent, enemy. I want you to grab a copy and read it. But in the Complete Woman newspaper, somebody sent a question that the person said, I'm a lady of 30 years old and have a boyfriend who is 35 years. Sometime last year, my boyfriend was diagnosed with hepatitis B and had to undergo several other tests. Before then, he received treatment from a doctor who asked to see us both. He recommended screening to us he recommended screening us to see the extent of damage, but said there was none. I underwent a test to know my status. Fortunately, I was revealed to be negative. I, however, went for the vaccination and have completed all the 3. Doctor, I'm worried. I'm a worried girl. I'm thinking of settling down with him. Since we have been together for a very long time, our parents are aware of the relationship. Yet I seem not to know the consequences and need your advice. Please help me with these questions. We have put the response to this question in the Complete Woman newspaper. And there are lots of interesting issues, understanding low sperm count, and many, many, many more, which I believe will be of much interest to the general public. As you drive along the streets of, Accra, the whole country, right from the north to the south, east and west, just ask any newspaper vendor whether he or she has the Complete Woman newspaper, and grab your copy, grab your family copy. So, this is all about a Complete Woman television show. It's about bringing health information to the wonderful women of this country and their partners, and ensuring that there's much happiness in our homes. In fact, it's just the beginning of the series of getting to the bottom of the questions and the problems of the people. So I want you to send your questions right now. You may call our numbers on the screen. You can send me, a mail. The address is on the screen, or you can make a friend request or be a fan on my fan page, and let's interact. It's all about ensuring that you are healthy. Next week, same time, I'll be coming to you with much more interesting, answers and answers to the numerous questions we have received in our information department. God bless you for watching this program. Have a very wonderful time. Bye-bye.